For more on the story, we're joined by Dr. Zaher Sahloul in Chicago, who's the president of the non-profit organization MedGlobal. Really good to have you with us, Doctor. Over the last 15 years, you've witnessed some of the worst medical situations in various conflict zones around the globe. You've also been to Gaza during this war that's being waged by Israel. How does that compare to what you've seen in previous conflicts?
Well, thank you for having me. And as you've mentioned, my organization provides healthcare in disaster areas in more than 27 countries, including Gaza. But we also work in Sudan, in Yemen, in Syria, in Lebanon, in Ukraine, Colombia, and many other places. I've been in Gaza 4 times. I've been in many disaster areas more than 50 times in the last 14 years. I'm a critical care specialist. This is my daytime job. And what I've seen in Gaza is something that I haven't seen in any other place. There is a systematic destruction of healthcare system, especially in the last 22 months of war. There's a blockade that is preventing basic necessities, including food and medicine, to get into a population. There's also destruction of anything that can make Gaza livable for its population. And there is a huge displacement, mass displacement. Now, most of the population are displaced into very small area, 12% of the Gaza Strip. And there's, of course, famine and malnutrition. Our clinic in Gaza, just last week, we lost 5 children below age of 5 who died because of severe acute malnutrition. Also, we admitted to the hospital 19 children in the last 2 weeks. And this is a quadruple of the number that we had last week. The rates of acute malnutrition increased in Gaza by 650% compared to the pre-war rates, and by 200% compared since the beginning of this recent blockade. It is a systematic destruction of Gaza, of the healthcare system, and anything that can make the Strip livable to its population.
Earlier on in this war, we know Israeli forces had been targeting medical establishments across Gaza. They were already struggling to cope with the amount of injured Palestinians being taken into the few hospitals that were still operating. And now, as you pointed out, the enclave is dealing with mass malnutrition, a famine, as some organizations have put it. What needs to be done at this point in order to address the acute needs of people who are starving?
As you mentioned, the Gaza Strip right now is dealing with the worst case scenario of famine. According to IPC report that came yesterday, 500,000 people have the highest level of food insecurity, about 1 out of 4 people in Gaza. 70,000 children have acute malnutrition. 17,000 pregnant women, as in your report, have also acute malnutrition. I mean, they will have complications themselves, and also the babies who are born, if they are born alive. Things are getting worse, not better. And that started because of this recent blockade that the Israeli army has put on Gaza Strip 3 months ago, that is not allowing more than 28 trucks on average every day to get into Gaza, compared to 500 trucks before the war. And also switching the international UN system of distribution and more than 400 sites to the system that is administered by the Israeli army and the American contractors, the Gaza Humanitarian Foundation, that distribute food only in 4 sites. That means you are creating bottlenecks where people are fighting for food, desperate population, and they are killed while waiting. So what we need at this point is, first of all, ceasefire, of course, to stop the hostilities and the bombs and the missiles. And we need to have a scaling up of the humanitarian aid, opening all border crossings, allowing not only 25 or 70 trucks a day, but we need 1,000 trucks every day in Gaza right now because of the famine. And also because of the systematic destruction of irrigation, of water resources, of electricity, of things that will sustain the population. People in Gaza have been eating lentil for the past 3 months, and sometimes they don't find it. Many families eat less than a meal a day. The picture that you've shown Most of these people had 20 kilograms extra when the war started. Our doctors in Gaza lost 20 kilograms, each one of them. And they have money, but they cannot find anything in the market. So we need to scale up urgently the humanitarian aid. But Gaza needs also a Marshall Plan, because we are reaching a breaking point at this stage where things are accelerating in terms of complications on children, on the marginalized population, on pregnant women, on the elderly. People are dying because of infection related to low body immunities because of the malnutrition. And these are not counted deaths. Of course, we have more than 60,000 people who were killed, including 18,000 children, and 138,000 people who are injured. Most of them will have complications and infections, and they may die because of their injuries.
Okay, Dr. Zaher Sahloul, we'll have to leave it there, but the very best of luck with your work in Gaza, and thank you so much again for joining us.